and I'll be moderating the session today. The coronavirus pandemic has been going on for a few months so far, and cases continue to increase around the world, with fear from a second wave with the coming winter. After the initial lockdown and border closures, many countries started to open up and people have started to come out of their homes for work, shopping, and travel. This will increase the risk of people catching the coronavirus without stringent protective measures. It is therefore very important to know how to protect ourselves and our loved ones from catching the virus and to be able to recognize the coronavirus symptoms early on and know what to do. To discuss these points, we are honored to have here with us today Dr. Ali Al-Dibiat and Nurse Iram Sadruddin Varani from Kuwait. Dr. Ali studied medicine at the Aleppo School of Medicine in Syria and completed a Master of Philosophy and PhD at Newcastle University in the UK. He specialized in diabetes and endocrinology and internal medicine in England. He is a Fellow of the Royal College of Physicians of Edinburgh, an Honorary Research Associate at the Institute of Cellular Medicine at Newcastle University, and an External Examiner for the Diabetes Postgraduate Program at the University of South Wales. He currently works at Desman Diabetes Institute in Kuwait as a consultant in diabetes and endocrinology. Nurse Iram has completed her nursing diploma from Aga Khan University in Karachi, Pakistan. She works at New Mawasat Hospital in Kuwait as an infection control supervisor. Without further ado, I will now invite Dr. Ali to begin the session. Over to you, Dr. Ali.
Thanks for having joined us this evening. As you know, the novel coronavirus of 2019 has emerged from China back end of last year. It started to cause a disease called COVID-19. And it started in China there, and then slowly started to spread around the world. And as you can see by now, it has reached almost all parts of the world, including little islands in the oceans. And the cases internationally are increasing. This is the time when it started in China. There was an initial rise and the alert around the world started to occur. But then things settled in China and started to increase in other parts of the world. And the increase in cases is significant and continues to be at on a daily basis. And if we look at the different regions around the world, we see that when it started in China there, it settled down a bit, and then we see as if there is a second wave increasing there. Then the epicenter moved to Europe, and there was an increase in cases in Italy, Spain, and the UK. And thankfully, things started to settle down, as we can see in terms of the daily cases, to settle down. Now, as Europe started to open borders, we don't know whether this will result in a second wave of infection or not. In fact, we see some signs and hints of it in Spain when the cases started to rise. Then the epicenter moved to North America, and the cases increased and started to settle down with the quarantine and health measures of the authorities there. Then started to go up again as if a second wave is already going on there. In the Middle East, thankfully, we have less cases and the number of cases is settled. It's not increasing. But as you know, the countries in the Middle East are starting to open up the borders and losing the quarantine and curfew measures. And therefore, real vigilance is needed so that we do not experience a second wave. Latin America, unfortunately, is the epicenter now, and you can see the cases are increasing significantly. We've seen that Africa had less of the cases so far, and we worry that come winter that there may be an increase or a move of the epicenter there. Now, what happens when people get corona? If a person gets in contact with an infected person, there will be a period of incubation. And incubation is when the virus enters the system, starts to increase in number. And that takes about 5 days on average. It could be less if the immune system is weak. And then when symptoms occur, they would be in the form of fever, high temperature, cough, fatigue, loss of appetite, muscle aches and pains, diarrhea, less sense of smell or complete loss of it. Similarly for the taste, and some skin rashes. Thankfully, some people get no symptoms at all. Unfortunately, some people get the symptoms and they get worse, and things tend to become worse at around day 7 of getting the symptoms. And those people, about 40% of people, will get like a bit more moderate symptoms that will resolve later on. But a small number of those will have excessive shortness of breath, that they become unwell with it and may need admission to hospital. They need support with oxygen, they need support with intravenous fluids and agents to thin their blood. And a small minority, about 5%, end up in ITU needing intensive care support. So if we look at the overall spectrum, we see that 40% of people get no symptoms at all. So they get the infection, their immune system fight it, they get rid of it, and they don't know. It's good that this is happening, but we need to be careful there, because these people will still be able to transmit the disease to other people if they are not observing due diligence, if they are not observing good respiratory etiquette and hand hygiene and so on. 40% of people will get mild to moderate symptoms, and that is when they become a bit ill with it, but then their immune system fight it, and then they get over it with no issues. About 10% will get severe illness, which requires hospital admission, and maybe 5 will get admission to intensive care unit. 3% recover, and unfortunately 2% die. So the spectrum of symptoms related to COVID are wide, and people ask, what is the difference between COVID-19 and the seasonal flu, or the cold that we can get, or the allergy? As you can see, symptoms can be shared, but in COVID, the commonest symptoms are cough, fever, and shortness of breath, in addition to muscle aches and pains, headaches, fatigue, sore throat, and less loss of sense of smell and taste. While in flu, you don't get shortness of breath. And in cold, majority of symptoms are in the form of sneezing and runny nose. As for allergies, it's more catarrhal symptoms. You get runny nose, sneezing, and watery eyes. But we know now that the coronavirus of 2019 does not only affect the lungs. We know that it causes respiratory distress and maybe failure, but it affects other parts of the body as well. It affects the blood and increases clotting. It can affect the heart and causes funny heart rhythms. It can affect the pancreas, leading to low blood sugar or high blood sugar, and in some people, a condition called ketoacidosis, which is an emergency. It can affect the skin, and it has many manifestations, including rash, including some loss of hair. It can affect the bowels, and it can manifest as diarrhea. It may affect the liver, it affects the kidney, and some people end up with renal failure, needing dialysis for a short period of time, and also it affects the brain and nerves. Now, not everyone who gets it, as I mentioned, end up in hospital, but what increases your chance of getting into hospital if you get corona? Well, from this study, we can see diabetes is a major contributor. So if someone has diabetes, their chance of ending up in hospital if they get COVID-19 is higher than otherwise. Similarly, people with heart failure, people who have weak immune system, like those who had an organ transplantation, or those who have other immune conditions that they take immune suppressants to them. Also people with impaired lungs, those with COPD, high blood pressure. An important one is weight. Those with excess weight, if they get corona, their likelihood of ending up in hospital is higher than otherwise. And you can see here, if the body mass index, which is, if it is more than 40 kilograms per meter square, the chance is much higher than if someone is between 35 and 40. and 35 and 40 is higher than people who are 30 to 35. So the higher the weight, the higher the chance of the person becoming ill. Now, we've heard and everyone is worried about death because of corona, because of COVID-19, and it's a real worry. But if we look at the contribution of age, we see that there is something reassuring for those who are not old. So for people who are less than 55 years old, so 45, 54 and less, the mortality rate, the death rate is less than 0.5%. So if 1,000 people get the disease, maybe 5 will pass away because of it. But as the age increases, the rate of death increases significantly. For those who are more than 85 years of age, about 10.4% can pass away because of it. So it's about 1 in 10 who get corona may die because of it, if they are old, more than 85. Now, when someone gets corona and they recover from the virus, it's not the end of it, because some of the symptoms last for considerable period of time after recovery and becoming non-infected. So they don't have more viruses in their body to infect others. In this study from Rome on patients who were admitted to hospital and then were discharged, at 60 days after discharge from hospital, 60% of them had fatigue. So fatigue was in more than half of the patients, even 2 months after recovery. Shortness of breath is in more than 50%. Similarly, joint pain, chest pain, vision problems, cough, and so on and so forth. So someone who gets COVID-19 and recover from it may still have some symptoms that will persist for a period of time, but those eventually seem to settle and recover. Now, we always get the question here, can I get corona again if I had it before? So if someone gets infected with the novel coronavirus, if they get COVID-19, do they, and they recover from it, do they get the infection again? Well, the answer to that is not clear. There have been reports on people who were infected, they recovered, and then they got infected again. So with PCR evidence that the infection is clear. Now, the good news is in those patients, in those people, the infection have milder symptoms. So people don't get really ill with it. And everyone has recovered. No one has died from a second infection. But the most important point here is, and we don't know the answer to yet, is whether someone who had an infection in China, whether they will be able to have an immune system that will, immunity that will fight an infection of coronavirus that is now in America or Europe. And the reason for that is the virus has had some changes in it as it moved from one country to the other. And to give you kind of an analogy of this is, if you have a document and you make 100 copies and you give each copy to your friends and ask them to make 100 copies and ask each one to circulate and so on. So as the number of copies increase, you start to have new additions to the original document. So little dots here and there. And as the number of copies increase, you get more and more. And there will be a stage where the new document is different to the original one. And this is what we mean by this. So when the virus started in China, it had a certain identity. And as it moved to Europe, some mutations happened on the way. And then as it moved to the United States, the Americas, some mutations happened on the way. So the virus that is in the United States now is not identical to the one that it originated from in China. And every country has been closed so far, and now the countries are starting to open with a caution. Now we don't know whether a person who had immunity in China, if they get exposed to the virus in Europe, for example, whether they will fight it and not get the infection again. And therefore, we always ask for continued precaution, even if you had the infection and recovered from it. The other question is there a treatment for COVID-19? And the simple answer to that so far is no, there is no treatment for mild or moderate disease. And there is no treatment for prevention. For example, the likes of malaria. If we know that we are traveling to a country where there is malaria, we can take prophylaxis, we can take medications to help us avoid getting malaria in those places. Now for COVID-19, we don't have that as yet. There is some treatment for severe illness, those who are in ITU, those who need oxygen support. If they take dexamethasone, their chance of coming off oxygen is higher. Their chance of coming off the ventilator, the mechanical ventilator, is higher. But this is specifically in those circumstances and not for everyone, because dexamethasone has other side effects. There's a lot of research going on to try and find effective and safe treatment for corona, as well as vaccines. Now, the other question is there a vaccine as yet? So far, there's no certified vaccine yet, but there are really promising clinical results in clinical trials. These are not ready for clinical use yet. These are clinical trials. And I have to point to 2 points here. The first one is a virus needs to be safe. We don't want to give something that will cause damage to people, other illnesses, while protecting them from COVID-19. So it has to be safe. And at the same time, it has to be effective. It has to give immunity to people instead of just being a sham treatment. And this takes time. And to explain why it takes time, I'll take you through the journey of how vaccines are made. When there is what we call it pathogen, a bug, scientists look in the lab for possible vaccines. So they do research in what we call preclinical phase. And once a vaccine is identified and it's deemed to be safe in animal trials, it moves to what we call it the clinical trials phase. And this is 3 phases. Phase 1, which is safety. The vaccine is given to tens of people to make sure that it is safe. It doesn't look at efficacy per se. It's just looking at safety. We don't want to give it to people and cause illnesses. And if safety is achieved, then the candidate vaccine moves to phase 2, which is looking at safety again and the protection, immunogenicity, so its ability to trigger generation of antibodies in our bodies. And this stage is given to hundreds of patients in clinical trials. And if it is safe and if it is effective in generating antibodies, then the vaccine moves to phase 3. And phase 3 is given to thousands of patients or to people, looking at safety, efficacy, as well. And if it is successful, then the product moves into regulatory approvals and then used clinically. Now, the preclinical phase usually takes between 3 to 8 years. The clinical trials phase between 2 and 10 years. And in the regulatory approvals can take between 1 and 2 years. So far, since the beginning of the crisis in January until now, we have more than 115 candidate vaccines have been proposed. A lot of them are still in the preclinical phase, but few have passed to the clinical trials. We have a handful in phase 1 and phase 2, and at least 2 or 3 in phase 3, which is excellent. And you can see this long journey that takes years and years has been condensed in this 6 months or like 8 months coming. Now, the most important thing about this accelerated program is safety. We may have an effective vaccine, but we don't want it to cause illnesses to people or damage. And that's why, unless safety is guaranteed, there would not be a license for it to be used clinically. Now I'll hand you over to Sister Iram, who will take you through the prevention, protection, and containment.
Thank you, Dr. Ali. You explained very well about the disease process, symptoms, and the treatment. Now I will talk about the prevention, protection, and containment. Okay, so as we all aware that the protection, every time we are telling the prevention is the better than cure. So what is the practices, safety practices in the community? Like we need to be follow the hand hygiene, respiratory hygiene, social distancing, take care of the high risk group people. So before going to one by one each of them, I want to tell you about the mode of the transmission, which is very important, because if you know that how the infection is transmitted, then only you can able to do the prevention. Okay, so the mode of the transmission of the infection is two ways, like the droplet and the contact. Droplet means that whenever any person is coughing and sneezing, then the droplet will come to the infected person, will go down. If the person is sitting near to you or standing near to you, they can be get infected with this droplet, or this droplet will go to the surface, or then if any person is touching the surface, then the infected person droplets are coming in their hand, and then when they do the handshake with others or they will touch the others, then the virus is transmitted. So this is this is how the infection is transmitted. So now we will go one by one to the each preventive measures. Number one is hand hygiene prevention. So now what to do? Hand hygiene means that the cleaning of the one hands of to substantially reduce potential germs. Okay, so what you need to do, we have everything for the hand hygiene, we have do and don'ts. So you need to be, make sure that you need to be vigorously rub your hands among each other 20 seconds with the help of the soap and water. Okay, when we are doing our normal hand hygiene, normal hand washing, sometimes we are forgetting some of the place in the hand. As you see that our hands are not flat, it's curved and like this. So when you do the hand hygiene, you need to make sure that you cover all the areas, especially see these areas, these are called the blind areas. So if you will not do the proper hand hygiene, these microbes are very small and this virus can be stay there, and then if the hand hygiene is not properly, then you can this can be get infected with this. So you need to be do wash hand with soap and water 20 seconds, vigorously rub. And then if the soap and water is not available, then you need to use the 70% alcohol based hand rub. And then you need to do the same thing 20 seconds. You need to be cover your whole hand doing the hand washing. Okay. For the don't, we need to make sure that we cannot be touch our eyes and nose and mouth with our hands, which is unclean or unwashed. And then we will not touch the like our surfaces. As I told you, this virus, when anybody is coughing, it's go down and stay on the surface. So you make sure that you cannot touch the surfaces, and if you will touch, then you need to be make sure that you will do the hand hygiene. So some surfaces called the high touch surfaces. High touch surfaces mean that the most frequently touched by the different people. Like for example, your switch buttons, your mobile, your TV remote control, and all these things. So you need to be make sure that these kind of items should be, whenever you are touching, you need to do the hand washing. The second precaution is about the respiratory hygiene. Okay, so for respiratory hygiene, what we exactly need to do? So any person is coughing and sneezing, then they need to be make sure that they cover their cough with the help of the tissue paper. And then this tissue paper should be thrown into the dustbin immediately. Sometimes we are human beings, we are keeping this tissue paper after use, keep on the tables, which can cause the infections for others. So make sure that whenever you are using tissue paper, it directly throw into the dustbin. And then after that, you make sure that you will do your hand washing. Okay, and for the don'ts, what you need to make sure that you cannot be cough in an open area or sneeze in an open area. And when the tissue paper is not available, you should bend your hand like this and you do the coughing or sneezing. Don't use your sari pallus or the dupattas to just cover your mouth, because sometimes the household ladies who has dupatta, they are using, there is no tissue paper, so they use their dupattas and pallus. So don't do like this. Use a tissue paper, and if it's not there, do like this. Okay, and don't spit in the open area. Now the prevention, the third prevention is the social distancing. It's also very important. This is means that deliberately the physical space between the people to avoid spreading illness. Staying at least 2 meters away from other people lessen your chance of catching COVID. So as I told you, that if you are nearby and you are not maintaining the social distance, then you can be easily infected with the person who has COVID or who has the symptoms. So what you need to do, that you should not be go unnecessarily out from your house. Okay, just stay in your house and maintain the distance 2 meters between yourself and the another person. Okay, and then for don't you don't hold event where people can gather together, because we need to be take care ourselves and our community also. And do not go to the crowded places like market, shopping malls, and then don't use the public transport. I will show you one slide. Yeah. So see what is the vital importance of maintaining the social distancing, how the reduction in social contact can reduce the spread of the coronavirus. So for example, if a one infected person, they will do the normal behavior in 5 days. In the 5 days, he can infect 2.5 people. Okay. And in 30 days, they can be infect 406 people. So if this person will maintaining the social distancing and follow the prevention methods, 50% if he will follow, then he will be infect in 5 days 1.25 people and 50 in a 30 days. And if he will be follow 75% precautions, then only 0.625 people get infected in 5 days and 2.5 people in 30 days. So you see how huge difference. Then if you will be normally behave, 406, and if you will do the precautions, 2.5. This 2.5 is only 75% follow the prevention. So if you will 100% follow, surely you cannot get the infection easily. So another thing about, we need to take care of the high risk group. So what is high risk group? That are the people who are in high risk from severe illness if they get COVID. This includes, as Dr. Ali also mentioned about the high risk admissions and all this. So those who are more than 50 years of age, the people who have underlying medical conditions like heart diseases, diabetes, lung disease, kidney disease, immunocompromised, and on so many medications, and the pregnant women. Actually, the studies until now didn't tell that how much impact in the pregnancy of this COVID virus, but we better to take care of this pregnant ladies also. Okay, in this slide, I will show you, I will tell you about the definitions, because since we are hearing COVID-19, there are different terms we are listening from different people, like this person is suspected, this person is probable, these are the contacts. So what is exactly this is? This suspect means that the person who is having the symptoms, as Dr. Ali explained about the symptoms, like less of taste of smell, fever, respiratory etiquette, these are the symptoms. And also those who have a traveling history of last 14 days prior to the symptoms, and who has a contact with a person who has symptoms. So these people are called the contact and the probable. And who is considered as a contact people? Contact people means the person who directly involved in the care of the patient who has COVID positive, and then who didn't follow the precautions. What we are telling about the precautions, like you are going out, you will wear mask and all these things. These precautions, if we will not follow, then we can be easily catch to the COVID, and also we will they will say us that they are the contact people. So the definition is the definition of the contact people, like staying in the same close environment of the COVID-19 patients, traveling together in the close proximity less than 2 meters. So these are called the contact people. In the contact also, there is two kind of things, like high risk contact and the low risk contact. Now, who is the low risk contact means? Low risk contact means those people who are away with the person, although they are living together, but they will be not share the same room and same place, and they will maintaining the distance, or they are following the proper PPE. PPE means the personal protective equipment, like we are using the mask and gloves. These are called PPE, and they are following all these things. They are traveling together but maintain a social distance and follow the proper precautions. And high risk contact means those who are touch the body fluids, or who will be contact with, like I told you, like shake hand, when they are doing the shake hand, and if your hand are infected, that's called contact. So you get the virus, and then if you didn't follow the prevention, then you can get the infection. And who had direct physical contact with the body of the patient, like shake hands, hugs, and all this, and then who clean the linens together, like with the normal person linen with the infected person, or they are using the same utensils without cleaning, and then they will not make sure that the environment cleaning and all this. So these are called the high risk contact people. Okay, so the other thing, what we are advising for the contact people. Okay, now the contact people, if this contact person is asymptomatic, so then again he know that, okay, I have a fever or shortness of breath or respiratory etiquette. In this case, he should be immediately go to their ministry clinic, wherever their district clinic, like if they are living somewhere, whatever the nearly clinic, they need to go there. And asymptomatic people who don't have any symptom, then what they will do to go in the clinic, because doctor will not treat them. So what they need to do, they need to be quarantined themselves. They need to home quarantine themselves for 14 days after the last exposure of the case, and then they need to do the self-monitoring of their own health status, like checking the temperatures, and just see if they feel shortness of breath, then immediately they will become symptomatic and they need to be referred to the clinic. And then they need to be take care the direct and high risk contact confirmed case should be tested. Okay, now as Dr. Ali already told you that the incubation period, like the morely they will start become symptomatic 15 to 7 days. So these are the good period of time when you need to do your swab test. So here it's written, if you will be asymptomatic after 5 or 14 days, you need to do your swab test. Okay, so Ministry of Health giving a clear instruction about the quarantine people and the persons what they need to do when they are in the isolation. So if the instruction for the people who are quarantined, what they need to exactly do, they need to be first of all stay in a separate room, okay, and preferably to use the separate bathroom. If in the house, if there is no 2 bathrooms, only 1 bathroom, and they cannot do, then what they need to do, they need to make sure that the bathroom should be clean after each and every use. Okay, and they need to stay home and avoid going to the public places, schools, or their jobs and all this. And then avoid to direct contact with the household person. Use cough etiquette, as I told you, need to be covered if you have a cough and sneeze. And then use a mask if you need to go too close to them for any reason. Like for example, if any person is taking, you are the one who taking care of a COVID person, then you need to wear, you need to do the hand hygiene and put mask, avoid touching your eyes or nose. This all I already told you that these are the preventive measures what we need to do. Do not leave your room, do not share your utensils and equipment. Should be make sure that you will clean it. And another instruction for the people who are isolated, okay, and who are sharing the house with the quarantine person. Now, for example, any person is COVID positive, and of course he will be staying in her house. So he is the one who is isolated, and the another person of the house is in quarantine. So first of all, for the isolated person, they should not allow any visitors to come to your house, okay? And household people also should not enter in your room. And if it's urgent, then they need to follow all the PPE and ensure that your room is well ventilated, and avoid monitored use. If you will use the same bathroom, as I told you, you need to make sure the cleaning, then again the hand washing, and then you need to monitor yourself health status. Throw your mask and gloves should be into the dustbins, and don't keep here and there. Wash your utensils properly, and then clean your house daily. Sanitize your house daily with the bleach, okay, chlorine bleach tablets, which is available, or the solutions are available. You need to use the chlorine, okay. And here in this slide we are summarize all the things that what you exactly need to do, that you need to make sure how you will keep your environment safe. So you need to do the hand hygiene, you need to do the respiratory etiquettes to follow. You need to make sure that you will be, if any person is using the utensils or clothes, if the infected person, you can be not mix with the normal persons, and then you will clean separately. You need to clean your environment, home, laundry should be washed separately. So all these things, what I told you, this is a repetition of the slides. So whenever you are using PPE, should be thrown into the dustbin, and all these things.
Thank you very much, Iram. So in summary, the vast majority of people who get COVID-19 will have mild disease and they will have full recovery. But we still say prevention is better than cure. It's absolutely important to take care of ourselves and our loved ones. Prevention is certainly better than cure. Stay safe and practice high standard of hygiene. Limit contact with others to the bare minimum, at least in this unsure time. Do not avoid getting tested if you have symptoms suggestive of COVID-19. Please seek medical attention and don't hide it. If you care about yourself and your loved ones, if you have any symptoms, please seek help, seek advice, and always keep an eye out for the authorities' updates. As you know, things are changing on a daily basis, and the authorities keep change their advices and their directives in adaptation to those changing circumstances. So keep updated with your local authorities' suggestions and advices. If you are not sure about anything, please reach out to your local teams and we will be more than happy to support you.